Hello. This is a short video that is going to describe my integrative technique that I used over the semester, how I implemented it, a little bit about the results from the implementation process, and the subjective feedback that I had received from it. So to begin, the technique that I decided to choose was yoga. The reasoning behind this is that I had and still am working with two female athletes. I started working with them in rehab at the beginning of the semester, and we were working a lot around the hips for strengthening and mobility purposes for certain issues that they had. And therefore, I found that this would be the perfect opportunity to see how implementing yoga could further increase their hip mobility, as at least one of them really needed to increase her range of motion. And so there's many different types of people out there that utilize yoga, and these people come from different backgrounds of athleticism. And it's because yoga has not only been known and studied and proven to increase physical fitness in many different ways, but also mental health as well. And so many athletes utilize yoga to increase strength, flexibility, balance. They even use it to better their breathing techniques and decrease stress levels. So I specifically wanted to use yoga to increase flexibility, specifically in the hip area with these two female patients. So therefore, I chose a 20-minute yoga tutorial video that I had found online after searching, and it focused on hip stretching techniques and relaxation techniques. And so to begin, also with the 20-minute video, I decided to utilize a goniometer to measure their hip range of motion before and after they completed the yoga session. And then I also chose the global rating of change scale as my patient rated outcome for them to fill out after each yoga session was completed. So how the implementation process started was, overall, these two patients had completed about 5 sessions of yoga over the past 6 weeks. So starting about the beginning of October is when this all started for them. And each session was structured the same. So what they would do is they would come in dressed appropriately, ready for rehab, and then they would do a 5-minute bike warm-up set at a moderate pace. And I set the pace for them, for both of them, so it was the same. And then after the 5-minute bike warm-up, we went and I measured range of motion, so hip flexion and hip extension only in both patients, and that was considered the pre-measurement before the yoga video tutorial. And so then they completed the yoga tutorial for about 20 minutes. Then we took hip flexion, hip extension measurements again. And then lastly, they filled out the global rating of change scale after their measurements were taken. So that was how each session was pretty much structured. And they were very faithful. And another reason why I chose both of them was because I knew that they were going to be able to make the commitment. And the commitment was about 40 minutes of their time. Total by the time they got dressed and then by the time they left. So, there was obviously quite a bit of numbers for data for just 5 sessions. But what I really wanted to emphasize in this video are the difference between the pre-measurements from the first session and the pre-measurements of the last session. I think those measurements specifically show the improvement that I was looking for, but they also show if yoga was actually being beneficial from the start of the yoga program to the end. So for patient 1, she already had pretty normal range of motion, and so her very first pre-measurements for her left hip, specifically in flexion, was 103 degrees. And then in her right hip was 109 degrees. And then the last pre-measurement for hip flexion was 140 degrees. versus for her right hip 126. So this day in particular, for her last pre-measurement for hip flexion, she felt really tight, and she mentioned that day. She has had higher measurements than 126 degrees of right hip flexion, but the data is the data, and obviously I can't change it. So she changed for her left hip and hip flexion about 37 degrees total, and then in her right hip about 17 degrees. So she had quite a change from the very first week of yoga to the last week, just in hip flexion alone. For patient 2, she started out with very poor range of motion. So if we look at hip flexion for her, her very first pre-measurements in her left hip, she had 70 degrees of hip flexion. And then in her right hip, she only had 60 degrees. So we always joke about it. We always joke about it too. She knew that she's not a very flexible person. But she worked hard, and her last pre-measurement for her left hip flexion was 111 degrees, and her last pre-measurement for her right hip for hip flexion was 113 degrees. So overall, left hip flexion improved 41 degrees, and right hip flexion improved 53 degrees. So she had great improvement, but we also have to keep in mind that she didn't have appropriate range of motion to even begin with. But I was still very proud of her and what she accomplished. So that was just hip flexion examples. There's a lot more data. There's obviously hip extension. Both of them did improve in hip extension as well. About an average for patient 1, I believe she improved about 5 degrees. She already had good hip extension. And then for patient 2, she improved about 10 degrees in hip extension from the very first session to the last for pre-measurements. So both of them improved in those areas as well. When we talk about individual sessions, both females improved about 5 to 10 degrees on average within the individual session. So as soon as I measured pre-measurements versus post, that's how much they improved, was an average of 5 to 10 degrees between them. So that also is good, just to see that there was immediate improvement in some way. When we talk about the global rating of change scale, patient 1, so the one with already normalized range of motion, she had her 5 ratings as 3, 1, 2, 5, 4, which I know are just random numbers, maybe to you, but this pretty much means that she rated the intervention as being a tiny bit effective or feeling a tiny bit different to quite a bit better. So she pretty much said that in some way the yoga had a somewhat positive effect on her in the way she physically felt from before the intervention was applied to after. The patient number 2 with the lack of range of motion, she had her ratings as listed 3, 4, 2, 3, and 5 to cover her 5 sessions. So this ranged from a little bit better to quite a bit better. So both patients decided that the intervention, that yoga was making them feel physically better in some way, even if it was just a little bit or a tiny bit. So when we think about subjective feedback, both of them really appreciated the yoga sessions. They both felt like they improved their flexibility. They overall felt better because then when we did other rehab the rest of the week, they felt like they could get further in their hip range of motion for certain exercises I would give them to do. So both of them really appreciated the program, and both of them actually wanted to continue it as well. So very positive feedback from there. The only thing that they had to say that was maybe not as positive was that they would be a little bit sore after the yoga would be done, the yoga tutorial, just because maybe they were tight that day or they had played sports or who knows what. And they think that sometimes their lack of better improvement within that session was because they were feeling sore immediately after the tutorial. So, but the soreness never seemed to last more than a couple hours. And then the next day they felt a lot better. So that's something that maybe I can keep in mind when I'm trying to measure range of motion, and say I want to implement this yoga program again. I think it's something to keep in mind when I measure range of motion and how the effects of the intervention can affect the way the measurements turn out. So I really overall loved doing this yoga program. Mostly because I picked two really great patients to work with. I already loved working with them to begin with. But it was really awesome to see these results. I actually really was proud of this little tiny program that I implemented, and I bettered the patients' lives physically, at least. When it maybe trying to implement a yoga program with the soccer teams next year within their preseason, just to increase specifically hip mobility, because over soccer season this past year we did have some hip issues. So I am grateful for this opportunity that I had, and I can't wait to try and see how I can implement it again. Thank you.